If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to the 9th season of Ask the Doctor. This series was created to assist you in understanding medical issues so you can take charge of your own health. We have a really great panel for you tonight. Now, there are 2 ways to get your questions through. First, by calling in tonight. Second is by visiting the website at netny.net/askthedoctor. I'll take those questions for future discussions or for my video blogs. For this episode, I have Dr. Katapati, an internal medicine attending at the New York Methodist Hospital. Next to her, I have Dr. Placido Morano, a rheumatology attending at New York Methodist Hospital. And then we have Dr. Terry Borden, the chair of the Department of Counseling and Development at CW Post/Long Island University. Welcome to all of you. It's a really great show tonight, and I'm excited about it. And I want to get to it quickly, but we have to cover some of the news that's occurred in the past week. And of course, heading up the thing is the H1N1 flu update. What about it? And probably the biggest area of concern is in pregnancy. And this is an area where pregnant women have misconceptions about the flu vaccine. There's no reason not to get this flu vaccine. As a matter of fact, it's better for your babies to have the flu vaccine because it gives the baby immunity in the first few months of life. And we're not allowed to give the baby a shot until it's 6 months old. So by getting the vaccine, you're not only protecting yourself, but you're getting 2 for 1. You're protecting the baby. So and if you have twins, it's even better, right? Because then you get two more, and triplets even better. So you definitely, it's been tested, it's safe, and I highly recommend for pregnant women. Very important. And children from 6 months up should be getting this as well, because this is the biggest area where we're getting deaths, unexpected deaths in previously healthy children. 6 times as many deaths are occurring in this category than we would expect. So you want to protect your children. The way to do it is not by refusing a flu vaccine, but by making sure you get both the regular flu and the H1N1 flu vaccine or the swine flu. So I urge you to do that. If you have any questions, call me or speak with your doctors about it. Now, some good news that came out this week. Babies born in this century can expect to live until the age of 100. Now, this is great news. The only thing is that you have to support them till they're 72. You know, they're in your house. You can't get them out. They're 78 years old, and you can't get the woman out. So, but what we're going to do is, this led a lot of us out. You know, I heard Dr. Borden said, yeah, but I'm not a baby born. You know, how's that going to help me? So I come up with a top 10 list of how anybody in the audience can live to be 100. And genetics is not as important as we thought it might be. It's only about 20 to 30% in determining how long you live. So you can't tell me, oh, my mother died young, I'm going to die young. It doesn't happen. So the number one answer is to avoid obesity. This increases your chance of cancer, heart disease, diabetes. So avoid obesity. I know it's easier said than done, but it's important. Second, exercise into old age. People who are exercising, that means even taking a walk in the park or doing housework, are living longer than people who are sedentary. So you don't have to go into the gym and get all sweaty. Exercise and you're going to live long. Now the third one, a lot of people think is a joke, floss every day. Get that dental floss and do a good job on the teeth and the gums, because the bacteria that are in the gums are the bacteria that cause the heart arteries to harden and to develop blockage and cause heart attacks. So go for your cleanings, but floss every day. Fourth, don't go crazy over little things. The studies show you go crazy over little things, you hurt yourself more than anything else. You get aggravated with traffic, it causes stress hormones to occur in the body, which causes you to get diabetes and heart disease, and it's not good. So you're only hurting yourself. The fifth one, throw away the vitamins, eat fruit and vegetables. It seems that getting the vitamins in the pills doesn't work as well as getting it in the fruit and vegetables. Maybe because there are combinations in fruit and vegetables that you don't get in the vitamins. So you can't take vitamins and think, oh, I'm doing everything I need. Better to eat the fruit and vegetables. Next, don't retire. And I know people don't want to hear that. I know Dr. Morano's cringing, he's counting on that retirement, but you don't want to retire because you're retiring, it just accelerates your chance of death and you don't do well. Second, do a crossword puzzle or a mind game every day. Keeps the mind active, staves off Alzheimer's disease, and it keeps you sharp. Stay connected to friends in church. By doing this, again, the studies show these are the people who live longest. So you want to be social. You want to talk to your friends and so on and keep friends. This is one interesting one. Eat until you're 80% full. Now, you're not sure exactly 80%. Eat about 80% of the plate, or don't stuff yourself. People who eat fewer calories live longer, and this will save about 300 calories a day. So 80% full. And next, get at least 8 hours of sleep a night. And this is important, and it's also, again, keeps your weight down, and it's very important. So if you need to get to sleep, we sell our tapes, actually. This show will be going out. It'll be available at the end. If you need to sleep, you can buy it. What do you think, Dr. Moreno? Good?
I don't know if that's going to work.
Okay.
Not with me.
Okay, so those are some exciting things I hope to live long. And now one of the things, exercise the mind. Let's talk about our quiz. This is a tough one now. I don't know how many are going to get it. What was the original language of the first Bible printed in the U.S.? Okay, I'll repeat it. The original language of the first Bible printed in the United States. It's a tough one. We'll see what you think. I know it's a smart group out there. And before we get back and meet our guests and so on, I just want to mention two people that I ran into during the week. One is Claudia Block, or Wackenfeld. Ran into her, big fan of the show. I like to mention her. And also Annie on Cordelia Road. Keep her last name not mentioned due to for anonymity purposes, but very nice woman who enjoys the show. So let's take a quick break. Our phone number is 718-499-6101. When we come back, you're going to talk about internal medicine, rheumatology, and mental health. So we'll take a short break, and we come back, we're going to go right to the phones. Again, the number is 718-499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor, and our topics are internal medicine, rheumatology, and mental health, and the number to call is 718-499-6101. Now, I was corrected by Dr. Moreno. Although we had up on the screen 6 hours, I think I said 8 hours, and I don't want people losing sleep over the 2 hours worrying they're not getting enough. 6 hours is enough sleep, and I see Monsignor Bennett is out there, hasn't missed a show in 9 years. Monsignor, how many hours are you getting? Monsignor's getting 7 hours a night. It's a good answer, and that's why he does so well. Thanks, Monsignor, for your support. We're going to get right to the first call, and we want to see if it's Joel, Maddie, or some other guest. We get a tremendous, they get a tremendous pleasure out of being the first caller. Let's see who it might be. Hello, who is this, please?
Hello, this is Maddie.
Maddie made it in. Maddie, you beat Joel again.
What?
What do you think about that? First caller of the day.
Yes.
Is that it's nice, right?
Yeah.
Yeah.
I want to know what.
Maddie's so overwhelmed with being the first caller, she forgot a question. What's the question, Maddie?
The question is, my nose runs in the morning like water.
Okay, I'm going to ask Dr. Kadavani. Maddie's having runny nose in the morning, very watery discharge. What about that?
It sounds like it might be allergies, Maddie. I mean, have you had issues with allergies before?
Not really. Not that I know of.
Yeah. Do you have any sneezing or?
I mean, it doesn't really. I mean, it's no big deal, but it just runs like water, and my eyes tear up.
Oh yeah, that definitely sounds like allergies.
Yeah.
So, yeah, I mean, there are some medications you can take. Claritin over the counter, as long as you don't have any contraindications for that. That would help the allergy. If not, you can see an allergist to get evaluated exactly what you're allergic to.
Maddie, I hope that helps. So it sounds like allergies, and Dr. Kadapani suggesting Claritin or one of those drugs, Claritin D, okay?
Okay.
Feel better. Now we're going to meet our guests, because we have two old-time guests, but not old in age, and one new-time guest. And before I get to them, I want to talk about the Twilight Zone, not because there's any Twilight Zone feeling, but this is actually, when I read off the 9th season of Ask the Doctor, it amazed me, because the Twilight Zone was on for only 5 seasons. So this show has actually outlived the Twilight Zone. But tonight, this very night, is the 50th anniversary of the first show of the Twilight Zone.
Wow.
A lot of people watch that. Rod Serling, always had the bizarre twist. So I thought it'd be interesting if the people calling in tonight would like to talk about their favorite episode. the cookbook. Do you remember that, To Serve Man? It turned out to be a cookbook. So some of those. I'm curious what your favorite episodes were. So think about that, and we'll talk about it when you call in. But now, getting away from the Twilight Zone, I want to talk to Dr. Katapati, who just got back from India recently.
Yes, yes.
Which part did you go to?
The southern part of India. It's called Bangalore.
My wife went to medical school there. Very nice.
Yeah, that's where I went to medical school too.
Oh, really?
Yeah,
It's a good
Bangalore.
place, right?
Yes.
Yeah.
Yes.
And it's beautiful there, right? Trees and beautiful.
Yes, very nice. It's called the Garden City of India.
Beautiful. Did you take the family?
Yes, yes.
Very
That's
nice.
why, I have my parents there. We went to visit the grandparents. with
That's
the
fun.
kids.
That's fun. Did you
Yes.
take your episodes of Ask the Doctor to show them?
Yeah.
Yes, it's a big hit in India. I know that. I know a lot of you out there in India loving
A lot
that
of
show.
fans in India too.
Yes, yes. But thanks a lot for coming down. And I know we're looking forward to hearing your expert answers as always. And Dr. Morano, who always is a pleasure.
Thank you.
Stirs a lot of controversy sometimes, but always a pleasure, a lot of laughs. How are you doing?
Good, I think.
I know you were at a meeting earlier tonight and just got here a little before the show.
Townhouse meeting for doctors.
Very good. There's a lot of issues with this healthcare bill and so on, and we have it on our website. If you go to the forum, Barbara Stevens did a brilliant edition of what to expect with the healthcare and her opinions. I ask you to look on there and see what you think. So, anything new in your life? What's new?
No, it's my birthday.
Today?
Yesterday.
Wow, no, that doesn't count. No,
Doesn't count?
He's looking for the gifts. Okay. No, but
I tried.
no, but what did you do? Did you eat at a special
My
restaurant?
wife, thank God, she made a nice meal for me, and we had a nice cake, and I enjoyed my family.
Oh, that's
Thank
very
you.
nice.
Thank you, guys.
So I want to wish you happy.
Oh, thank you very much.
Happy and healthy, many, many more. And thanks for everything.
Actuarial tables go to 120 now.
Yeah.
So we used to say cent'anni in Italian. Now we say 120, 120 years.
That's great.
Yeah.
That's great. So we're going to get to some good questions. All you with aches and pains out there, you know who you are. You're going to be calling in for Dr. Morano. And then, Doctor, I was going to say Lizzie Borden, but that's someone else. Dr. Terry Borden.
I didn't take any wax.
Who is that? But you're currently the chairperson.
Yeah.
Do you say chairman or chairperson?
You can say either
Chairwoman.
one.
Chairwoman at
Yeah.
Long Island University and CW Post.
Yes.
In what
The
is it?
Department of Counseling and Development.
So now, what do the people you train? What would they do? The people you
They
train?
would be becoming school counselors or mental health counselors, working at agencies, hospitals, private practice.
Very nice. So you're training people to go out and help others.
Yes.
And I know a lot of our people have their kids, their grandchildren in school. They're worried. Kid is a little hyperactive, not learning properly, maybe depressed. How do you know these signs? Things that I know they're going to want to ask you, and we're going to find that out. I know you had a radio show. You told me of
Yes,
your
I
own.
did, yeah.
What channel was that?
I had a show. I was co-host of Here's to Your Health on WNYG, an AM station.
Very
and then I
nice.
had my own show, Dr. Terry Borden and Company.
I'm nervous that you're here. So we're taking over the show.
No,
Next thing is
I-
ask Dr. Terry Borden. I'm out of a job.
I'm
I
not
don't know
used to
what's-
being watched, though. You know, this I could
Oh
go
yeah,
like this.
we
I
get
could,
audience on the show. It's a
yeah.
good audience. So we're going to get to your questions, and we're going to have a lot of fun. So let's looking at your Twilight Zone episodes and so on. And here, John. Hi, John.
Hi, Doc.
John, you ever watch the Twilight Zone?
Oh, yeah.
What's your favorite episode?
That one, I think it was a Twilight Zone when they the disfigured face for that lady, and they took it off, and she was normal, and they were...
Right, in the land of the king, the one-eyed is, in the land of the blind,
Blind,
the
the
one
one-eyed
king is
man
one.
is
Yeah.
king.
Yeah,
I think that was a Twilight Zone.
that was good. Well, she was beautiful, but everybody else was
Yeah.
hideous. That's a good
Yeah.
one. I like
Yes.
that one, John.
That was the lady from Beverly Hillbillies, Donna Douglas.
Was that her?
Yeah,
Wow.
Wow, good trivia.
yeah.
What can we do for you?
I have a mental health question.
Okay.
How do you tell the difference if someone is depressed or just feeling low?
Depressed versus feeling low. Dr. Borden?
That's a good question. Because again, some people feel blue. They feel somewhat sad, and they think to themselves, do I want to speak with someone about this? I would say that if you had extreme mood changes, if you had anxiety and it was to the point where you really couldn't function, certainly if there's any alcohol or substance abuse problems, but counseling really is wonderful to go. It reminds me of the Bette Midler film where she said, and she was talking about herself, and she went on and on and on, and then she turned to someone and said, but enough about me, let's talk about you. What do you think about me? Where else can you go and have that experience?
John?
Okay, good.
Thanks a lot for your call, and
Thank
thanks for
you.
the info. Take care. We're now going to go to, and it's a mystery, we have Michael online. For Michael thinks he has the answer to the quiz, but don't rip up your tickets at home yet until we make sure. Michael.
Yes.
Hi, there's a rumor that you have the answer to this quiz.
I believe so.
Okay, what do you think it is?
Latin?
Can you say that one more time?
Latin?
No. Sorry,
Oh.
sorry. No, I thought you had it, but it's a good quiz. It's not the first Bible printed. First Bible was printed in Boston in a different language, but I like that guess. It was a good one. A lot of people have called in with that. So I know you're a little downtrodden right now. I feel it down there, but we'll have Dr. Borden give you a little counseling if you need it. What was your favorite episode of The Twilight Zone?
When the Earth was getting close to the sun.
Oh, third planet. Where there was, and the woman thought she was going to die from the cold.
Uh-huh.
That was a great one. These were scary episodes, right? Send the chills through me.
I also have a question, a medical question.
What do you got?
Is it good to take 61 milligrams of aspirin every day?
Dr. Catapati, should he be taking aspirin every day?
It depends. How old are you?
46.
46. And do you have any medical problems?
No.
I don't think so. I mean, if you have medical problems that you need to take, prevention, or if you have a very strong family history of, cardiac problems like heart attacks, somebody in your immediate family had heart attacks when they were very young, when they were under 50. So, I mean, basically, you probably need to speak to somebody and get all those risk factors evaluated. And then, if you need, then you can be on it. Just for everybody, I mean, aspirin, is the magic pill, but for everybody to go on, there's no recommendation as of yet.
But I have to ask Dr. Morano, now you prescribe aspirin for some of your patients, but in a bigger dose. Does that help the heart?
I hardly, I'm not a heart specialist. I'm a rheumatologist, and I usually don't prescribe aspirin. Aspirin is non-acylated, irreversibly acylated, and so it stays in your system for a long time. I use short-acting, non-steroidal anti-inflammatory drugs, but they also have risks.
What would be an example of one of those drugs, just so they know?
Motrin,
okay.
naproxen.
Many people might be taking that.
Right. So aspirin, you have to be a little bit cautious also with aspirin use.
Yes.
So you want to be, you shouldn't just go off taking it.
No, I mean, because, like any medicine, it has its side effects. Even though it's a small dose, it's not 61 really. The baby aspirin is 81 milligrams. But even that has side effects. So you want to make sure that your benefits outweigh the risks. So.
Michael, thanks for the call.
Okay, thank you.
Be well. We have Joel. Hi, Joel.
Hi, Dr. Garner. Great in the news today.
Oh, thank you. I see Maddie. I'm sorry, you must be feeling a little down. Maddie beat you to the #1 call again.
Well, I wrote down all 10 of your rules, and I'm going to live my life by them from this day forward, so I feel better already.
See, he sees the bright side, right? It's important to look at the bright side, Dr. Borden?
Absolutely, yes.
Yeah?
Mm-hmm.
Always
look at the bright side.
It's half empty or full?
Oh, the caterpillar sees it as the end. The rest of the world sees it as a butterfly. It's how you look at it.
Poetic. Joel.
Yes.
What can we do for you today?
Well, I have a question for Dr. Borden.
Okay.
I think I may have just have gotten the answer. One of my friends, she's been very upset lately. She's kind of been depressed, and I don't think she wants to take medicine. What other ways can she go about treating this?
Another great question. But it's important to remember that you don't have to be sad. You don't have to be depressed. There is help. And to piggyback on the last question about depression, I think it's important to know that if something lasts for 2 weeks, you really do want to go and speak with someone about it. And absolutely, it's how you look at life. It's what you say to yourself. It's the tapes that you play over and over and over again in your mind. And that's what causes the depression. People will say, I'm sad because my boyfriend dropped me. But the reality is they're sad because what they tell themselves it means that my boyfriend dropped me. So to work on cognitions, to work on thoughts, very important. You don't have to take medication, but you should be open to the possibility that medication might short circuit some of those very sad feelings.
Joel, I hope you don't get sad feelings ever, and thanks so much for calling.
Thanks a lot, Dr. Garner. Thanks.
Take care. We got Loretta. Thinks she might have the answer to the quiz. Hi, Loretta.
Hi, Dr. Garner.
Where are you calling us from?
Bensonhurst.
Bensonhurst. We always have smart people.
It's got to have it then.
Yeah, Dr. Morano says you must have it if you're from Bensonhurst. What do you think the answer is to the first Bible, the language of the first Bible in the United States? Greek?
Yes.
I couldn't hear. One more time?
Greek.
No.
Oh, okay.
Thank you, though. We had Latin, Greek, but don't be sad about it. Now, do you have a medical question?
Yeah, I have one for the rheumatologist.
Rheumatologist, Dr. Morano is right here from Bensonhurst.
Yeah.
Yes. See, we make joy. See, we have joy. Is that your neighbor, too? We have Bay Ridge, Bensonhurst in the house, and I don't know where you come.
Well, Port Washington, but I
All
grew
right,
up in Queens.
In Queens, okay,
Queens.
not bad. Okay, what do you got, Dr. Morano? What do you think?
What's the
question?
I have Epstein-Barr virus, okay, with fibro. And I was wondering...
With what?
Fibromyalgia.
Ah.
But I have the Epstein-Barr on top of it. Now, last week I was sick, okay, and they had me on different medications. Would the Epstein-Barr affect the different medications with the immune system?
Okay. There is a chronic fatigue syndrome associated with Epstein-Barr virus.
That
People
also, right.
have association. But, and it overlaps with fibromyalgia, which overlaps with depression.
Right.
So it's hard to say this is a spectrum of a single disease or it's individual diseases. But fibromyalgia, you have to have several tender spots throughout your body, and you have to have fatigue with a poor sleeping pattern. And we have a number of drugs now that have been developed specifically for fibromyalgia. And fibromyalgia is chronic pain. Basically, these people have exacerbations that they can't function in a regular day.
Is that a real illness?
It's a real illness. And this has been a debate amongst doctors, internists, rheumatologists, mental health care providers, as well as scientists. This is a real disease. There are MRI changes of the brain in these people.
Right.
They have a super sensitivity to touch, as well as some people to smells and to noises. And so they suffer. They suffer on a regular basis. And what the drugs that are available now, there are drugs that are used also for depression. Cymbalta is one. Savella is another one, which is a medication developed. This is a new one.
Which one is that?
Lyrica is another one.
Yes.
And there are a number of muscle relaxants as well as pain medications. And there are a number of modalities that need to be used as well. To make a long story short, there are things out there that could help you, but there is no cure, unfortunately.
Right, I know that.
Good luck to you.
Okay, thank you.
Thank you for the call. Feel better.
Okay.
We now have Josephine, who thinks she might have the answer to this quiz. Josephine, hi, where are you calling us from?
I'm calling from Flushing.
Flushing, New York.
Oh, there's my
home of the
Lobo's from.
Mets. Right?
What's that?
Yeah, they don't like to admit that.
That's where I
The
grew
Mets.
up.
The Mets.
I'm from Flushing.
Okay. But anyway, what do you think the answer is to our question?
I think the answer is German.
Well, what?
German.
No, I'm sorry. And I thought you had it, but it's not German. Very
How
close.
about Latin?
No, only one quiz.
Did you go through the whole list?
No, she's from Flushing. Let her try again.
So, okay, what's the second one?
Latin.
No. Okay, but I like the try. I like the energy there. You sound a little downtrodden now.
Okay.
Do you have a medical issue we can help you with?
No, I'm 90 years old and I feel fine.
Wow, that's great.
What does she do?
I guess she's been following
On
the
that
10
list, what does she do?
principles.
I'm losing control of the group
Sorry.
there. What happened? How did you like that list that I gave?
Did I like what?
The list. You think it was accurate? The things that live to be 100?
Oh, yeah, it's great.
What's your secret? Do you have one secret you can give us?
A lot of them that's on your list.
Yeah.
First of all, I'm thin and I'm wiry and I get to church every morning.
There we go.
And, keep going. So that's it.
Great. You got to keep going. Keep calling us every week, okay?
All right, we'll see. I'll try some other time.
Okay. Good. Have a nice day.
Okay, thank you. Bye.
Okay. We have Geraldine now, who's on the line 4. Well, a lot of these languages have been used, Geraldine, so maybe you're getting close.
Hello?
Hi, where are you calling us from?
Hi, Dr. Gardner. I'm calling you from Bensonhurst,
Another
Brooklyn.
Benson. Yes, that's great. And I understand you think you have the answer to this quiz.
Yes, American Indian.
This woman is amazing. How did you get that?
I looked it up on the
Oh, she's honest, too. I like that. Honesty is very good.
Well, because it still worked my brain.
No, this is excellent. Worked your brain. And there's a particular group of Indians. I can be more specific, but I'm giving you the answer. It's Algonquin.
Algonquin?
But
Okay.
you get the plaque, the all-important handmade plaque out of Japan?
Yes.
You know that one.
Yes. Thank you very much.
Do you have a place for it?
Well, I'm going to be moving. Remember, I spoke to you a few weeks ago.
Oh, yes. You
So
moving to the
I'll
city?
make a place for it.
You moving to Manhattan?
Yes.
So
right
you have
right across the street from Cabrini Hospital.
Beautiful. So you'll take this with you. It'll be a reminder.
Yes.
Thanks so much for the calls. Hang on. We're going to get your name and address so we can get it out to you. We send it freight mail, so it takes a few days, okay?
Thank you very much.
Take
Good
care.
luck.
Wow, American Indian. That was a shock that she got. It scared me. Wow. Excellent call. Excellent. Shirley.
Yes.
Hi, Shirley. Were you surprised about that answer? American Indian or Native American?
Yes, I was. I was thinking English.
Me too. I was thinking it would have been English also. I thought nobody guessed English.
Right, right.
Where are you calling us from?
I'm calling from Canarsie, and my question is for the rheumatologist.
Okay, Dr. Morano's right here. What can we do?
Well, my sister-in-law is a senior citizen, over 70. She has the crippling arthritis.
Mm-hmm.
Her hands won't open. I mean, really, really bad. Right now, she's having excruciating pain in her eyes. She's been to 100 doctors. What they told her is that she has corrosion of the cornea.
Ooh. Okay,
Yeah.
that sounds like rheumatoid arthritis. Am I correct?
Oh, very, very, very bad. Very bad.
And rheumatoid arthritis, unfortunately, can cause eye problems. It could cause a corneal meltdown, where the whole layer of the eye in the front could just melt down, basically. And there are a number of medications that we have tried. I wonder if she's been to the ear and eyes and nose in the city. There's a couple of people there that might be able to help her. But what we do, we give medications that are very strong for use in rheumatoid arthritis. One of the medications are TNF inhibitors, and they could be used for this condition. If it is rheumatoid arthritis, because that's what it sounds like.
Oh, yes. She can't open either of her hands.
They could give injections. Actually, if family members could also give injections. These are TNF inhibitors. There are a number of them. Humira is one of them that's been used for anterior uveitis as well as posterior uveitis, as well as.
Should she go to her ophthalmologist?
She should definitely see an ophthalmologist that's
She's
specialized.
seen 100 doctors.
She's been to
in
New
and
York
out
Eye
of
and
several
Ear?
hospitals.
Yeah.
And they all say they can't do anything. So what I did was made a call to the Arthritis Foundation, but it's kind of difficult to connect with the right division. Right now I'm waiting for a call back from the Direct Patient Assistant Division.
You think you could help them out if they have need for a referral?
Depends on what they want to do, where they want to go.
Maybe we could do that off here. You got Dr. Morano's number. Give him a call to his office, and maybe we can help you out with a referral to try and cut
All right,
through the red tape.
keep the number there for a minute, please.
We're going to keep it for a minute. I just want to ask the other two doctors, rheumatoid arthritis, you see other associated conditions aside from the joint and the eye that we talked about, any other things, that heart disease or lung?
Yeah, lung disease, heart disease. Yeah.
So they really
It's a
increase.
multi-system, disease.
And we know about cancer. We know about how about the medical condition?
Chronic medical conditions and depression can go hand in hand.
Yes, she's been very depressed.
Yeah. And you might want to get that treated as well, because so often people ignore that and they say, well, of course she's depressed. Look, she can't move, she's in pain. Who wouldn't be depressed? But the reality is that depression can be helped. So just because you know that there's a specific situation and it doesn't seem to be getting any better does not mean that you should not go for help for the depression.
Thank you. I hope that helps. And we'll look. You got the number from Dr. Morano?
One more question. Is there hope for this?
It depends on how far advanced it is. If it's to advance to the point where there's scarring, then that's what will happen. There will be scarring in that area. You won't have normal cornea in that area, unfortunately. But there are medications that could try to combat this. Good luck. Okay. And if you want to give me a call in my office, we'll try to get you someone, all right?
Are you in Canarsie?
Right. Thank you very much.
She's in Canarsie?
Canarsie, yes.
Yeah, is that, remember Bracciamento's? That was off the pier there.
On the pier.
Yeah, it's too bad that's gone. That was a nice place.
It was.
Anyway, days gone by. Take care.
Thank you very much.
Bye. Let's go to Diane now. Hi, Diane.
Hi, how are you?
So what was your favorite Twilight Zone?
You know, the one where the guy, the whole world kind of like disappears and he's a librarian or something?
Oh, in the safe.
And his glasses break after all that.
Do you remember that one?
Oh.
He leans over, the glasses fall and break.
Yeah.
Oh, that was a great one.
Yeah, it really was.
What can we do? Where are you calling us from?
Brooklyn.
Beautiful.
From Carroll Gardens.
Carroll Gardens, great area, great pizza.
Yes, absolutely.
What can we do for you?
I have a mental health question.
Okay.
I want to know, is there such a thing as internet addiction?
Oh, internet addiction, and it's very interesting.
Absolutely, there is internet addiction. Without a doubt, we're learning more and more about it. If you stay on the internet and other areas of your life go, become very, very secondary. If you're having a problem, if you're becoming secretive about the internet, if you become angry or irritated because somebody takes you away from the internet, without a doubt there is internet addiction. And again, with help, you're going to see there's going to be a lot of 12-step programs, self-help programs that are going to just take off because of how sadly common this addiction is becoming.
You know,
it's going to be online?
It's going to, no, but that's an issue. That is an issue. Very good. It's very good.
Is this common among younger people
You know what it is?
or older people? Or?
Absolutely, yes. Very common among young people with games and whatnot. And sadly, internet addiction leads to other kinds of addiction as well.
See, our guests are up because just today there was a major study released that showed that adolescent boys were the most affected, more so in Japan actually than the United States, and it was often who was likely to be hit, but someone with attention deficit disorder or someone with depression. And it's very hard to treat. It's not just by saying you can't use the internet at all. Absolutely. So it's a very difficult process to treat. It's a real thing.
Absolutely,
and
yes.
it cuts across all ages, although more pronounced in the younger. Are your kids on the internet?
Yeah.
But we're not talking about watching the internet. This is, as Dr. Borden said, this is to the exclusion of normal life activities.
Yeah, this is like any other addiction where you're not, participating in the rest of your life.
Oh,
yeah.
We enjoyed that call. Thanks a lot.
Thank you.
Okay, let's take a little break now because we have some bills to pay. You know, we got our sponsors out there. They want to get in on the act. So our phone number is 718-499-6101. We've got a lot of callers, so just hang on. But you can talk about internal medicine, rheumatology, and mental health. So don't go away. We'll take a short break and be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor, and our topics are internal medicine, rheumatology, and mental health. And with me I have Dr. Catapati, Dr. Morano, and Dr. Terry Borden. Excuse me. The number to call is 718-499-6101. Now let's get right to the phones. But I use a little Purell, or you can use any product. And this is one of the main deterrents against swine flu, this Purell. I shook hands with you. I washed my hands because 30% of the transmissions are by touching the face, the eyes, after touching somebody who might have the disease. And the problem is the swine flu, for 2 days before you get symptoms, you can be infectious. So Dr. Morano, I hope he's not, but if he could develop the flu in 2 days and yet be spreading it around.
Before I came here, because I know you're going to shake hands.
But we had a very interesting break, and Dr. Morano was asking about mother-in-law depression to Dr. Borden, but not to his tremendous break. I'm sure his wife is going to so let's go right to the phones. Okay. So what can we do for you? Do you have mother-in-law depression?
What is it?
No, what's on your mind tonight?
I am going to go. I have AAA.
Okay.
Abdominal aortic aneurysms.
Yes.
And they want to do a procedure. I'm obese. And they want to do a procedure where you don't have the surgery.
Right.
They put stents in.
I'm going to ask Dr. Catapani to discuss that and see if you might be right for that. What about this, the stents? Just explain what they are and if you think it makes sense.
Definitely, especially if you're obese, because you're at high risk for open surgery. And, most of the time now, with AAA, they don't do open surgeries. It is done, the stenting is what they do.
Oh, really? Because I never heard of it, and I'm very wary of it.
No, that's the better way to go, but you just have to make sure that the surgeon who does it has a lot of experience with that. Just make sure that you go to a center where they do that. Yeah, because your, risks, you don't have the operative risks because they're not cutting you open.
Right. Well, that's what he tells me. Yes.
Yes.
Yeah.
So you just have to make sure the doctor, the surgeon who's doing it, has a lot of experience with that, and you should be fine. That's the way to go.
Okay, but listen, when they first discovered it, he told me that it's a very simple procedure, that I could even be out on the same day.
Yes.
But
Yes, because they're
now-
not actually cutting you open. And how big is your aneurysm?
It's 5.4.
Oh, yeah. So you should definitely get it done. Anything larger than 4 centimeters, you have a high risk of rupture, and stuff, so you should get it done.
Well, thank you very much for the call, and good luck. And let us know how it works out, okay?
Thank you very much.
Thank you. Hi, Michael. How are you?
Okay, doctor. How you doing?
So, Michael, tell me before what the favorite Twilight Zone of all time?
Sorry, I did a long time. I can't remember. I remember the guy, not any of those shows.
Rod Serling. You know, he
Rod
was only 5 feet 1 inches tall, and a big smoker, and he died of
Heart attack.
Heart attack is
Massive
yeah.
He had a distinctive voice.
Yeah, and what about that song, the music? Da 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 da. That was amazing.
That was quite a show.
So what can we do for you today?
Well, my problem is my fiance broke her 7th rib back in November, and it took a while for it to heal, like 3 or 4 months. And then after the bone healed, rib healed, she started to have a lot of pain and restriction in the same area that the rib was broken. She went to medicine doctor, medicine, go to pulmonary doctor. We went to a pain management doctor. They did a nerve block shot, did another type of shot. Those helped out. She went to a neurologist. The neurologist said that he really couldn't help it, didn't think there was anything wrong. One pain management doctor that she saw gave her some medication called lidoderm or lidoderm, and that didn't help. But meanwhile, now the restriction gotten worse, and the pain, and she, it's very upsetting because she had an MRI, a CAT scan, bone scan, dimensional, and nothing that showed up. So they can't quite know why it's causing the pain. So the process of going to an orthopedic doctor in a couple of days tomorrow, and she doesn't know what to do because, like I said, she's going to all these different doctors, getting physical therapy, did the massage and all that they do at a therapy place.
So, Michael, I want to recap here. From what correct me if I'm wrong. Was this a rib fracture?
She broke her 7th rib.
This was 7th
she
rib.
broke the 7th rib.
Okay, and now the pain won't go away. Yet, interestingly, they do an MRI, they do a bone scan that shows nothing.
CAT scan also.
Okay, so I'm going to turn to my panel.
How long ago was the rib fracture?
About 7 months.
Oh, wow.
There is such a thing as regional pain syndrome. Regional pain syndrome occurs from trauma, and it's sort of a parasympathetic system release where you have chronic, persistent pain. And some of these people in those areas can have either swelling, they can have either hot or cold in those areas, and it's very hard to eliminate. And again, this is usually a parasympathetic system that...
So that's against, not with your control, the body takes over.
Correct. Sort of a response. A lot of these people do have depression also. So it's hard to... Chronic pain management is the best people to deal with this. They do nerve blocks as well as other things. She's tried lidoderm patch, and lidoderm patches mostly for post-herpetic neuralgia, shingles, after having shingles. And maybe she had shingles there, I don't know, because stress could also lead to shingles developing.
You know what troubles me is that the bone scan should have been positive at 7 months. So
well, you haven't seen it, so he's saying that it's normal.
He's saying it's normal, but I think we need to fill in some bits of information that aren't there because, as Dr. Marino said, a pain management person should be able to give you a block to knock this nerve.
What you did, they did do that nerve block, and then they came out with another type of shot, radio and ablation shot, and nothing helped. The shot was very painful, and she's having a lot of pain and restriction. Sternum area associated with the 7th, and
she must be getting depressed too. I mean, you see a lot of people chronic pain.
Yes, she's depressed.
And they also use antidepressants for chronic pain.
Well, she took that.
Elavil?
No, another one that you see on TV a lot. Yes,
Cymbalta.
Cymbalta. She couldn't take it because she's only like 97 pounds.
Right.
She has some heart problems, but she couldn't take it because it made her very dizzy and everything.
We got to start from scratch here because I think we've come to the end of the line. We need to get a fresh opinion. I would get a second opinion at this point and follow that and just bring all your stuff to the
I'll
doctor.
go to chronic pain management, another chronic pain management doctor.
I agree with that, and you can get a referral. If you can't find one, call my office and we'll let you know, okay?
All right.
I'm sorry about that. Sounds like you have a tough time she's having. Hi, Marie?
Yes.
Where are you calling us from?
I'm from Brighton Beach.
Beautiful area.
Thank you.
Is Mrs. Stahl's Knishes still there?
No, not
No, that was
anymore.
that place was there for years and
Bygone
years.
days.
The
I
best.
know. It's not there anymore. It's been, oh my God, closed down many years ago. It was on Brighton Beach and Coney Island Avenue. It's no longer there.
I bet you a lot of people remember that place, Mrs. Stahl's.
Yeah.
And do you ever walk on the boardwalk?
I do that every day.
It's great, right? That exercise.
I have to. I do 3 miles mostly every day.
Wow.
Wow.
So you're following the top 10 list of to live a long life. Did you see that at the beginning of the show?
No, but in order to live a long life, I think genetics has a lot to do with it.
20 to 30% genetics. This show is repeated next week at 10 o'clock. So if you want to take it, you can watch from the beginning, okay? What can we do for you?
Okay, I have a question. I have 2 questions. One for the mental health person and the other one's for the internist. The first one is for the
Dr.
mental
Borden?
health person.
Okay.
Yeah. I have a very, very grave problem. I have a brother that's bipolar, and he was diagnosed when he was 15. First, he was diagnosed as being schizophrenic. Then they said he was bipolar years later, but he went into total remission from the age of 19 to 35 without any medications. He lived a perfectly normal life. Now it's a very, very sad situation. He's going to be 58 years old, and he never is stable. He's lucid for a few months. He's normal for a few months. Then he goes back into, most of the time, back into mania. And they've tried all medications. At the current time, he's in Richmond University Hospital in Staten Island, and he's been there for more than a month, and I don't see any improvement. And they're trying all sorts of drugs, and it's just not working. At one time, he was on lithium, and he was doing very well, but he had severe tremors with it. So he refuses to take lithium. Then Depakote, he claims that he had a seizure, but it's an anti-seizure medication, so he won't take that either. So they have him now on Trileptal, Trilofan, Ativan, and Haldol, PRN, and also they have him on Indarel.
You know, Marie, let me just stop because the question is a difficult one, a difficult disease to treat.
Yeah.
And Dr. Borden does more of the counseling, and I think she would admit that this disease requires a lot of a lot of medication as well as counseling, but more drugs. Dr. Borden?
Yeah, yes, drugs and talk therapy. But I think the most important thing is never give up hope. They're coming out with new medications all the time. There's going to be something down the pike that's going to be able to help him. So I hope that you don't lose hope, and I hope that he doesn't lose hope as well, because that's very, very important.
Yeah, but he's already going to be 58 years old, and most of his life has been, the past 22 years has been in hospitals.
Yeah.
He never has a moment of stability.
I know.
I mean, Dr. Katapani, what do you think, Dr. Katapani?
Yeah, I mean, she mentioned that lithium helped, but he had tremors, right? I mean,
but then
if
did
it's
a CAT
something
scan.
that he can live with, you know, the
No,
side
but you know
effects,
what
sometimes
happened?
if you can
No,
put
no,
up with
no.
the side
You know
effects,
what
and he
happened?
did well,
I
lithium is
understand
a...
Marie, wait. Let Dr. Katapani finish, and then you'll...
Okay.
So
Yeah, it's you know, been around a long time, and you know, it's one of the medications that's commonly used for bipolar. So, you know, if he can live with that side effect, maybe he should go back on the lithium. You know, if nothing else has really worked and lithium helped, he should probably do that.
No, but you know what? He has another problem. They did a CAT scan, and they said he has an infarcted area in his brain. So lithium is not really a good choice of drug as well. That's what they told me.
I want you to speak to Dr. Patel there. He's a good friend. And tell him you called the show and speak to him and let him, you know, maybe you can revisit it and see if there's a way to improve his quality of life. So ask for Dr. Patel.
Who's Dr. Patel?
He's one of the heads at the Richmond University.
Dr. at Richmond University?
Yes.
In Staten Island?
Yes, that's where you are, right?
Well, I'm not there. He's there.
I mean, that's where he is. Yeah, just let him, just maybe take a look in and see what he could do, okay?
Okay, can I ask the doctor one more question?
Sure, what
is
is
that possible?
Yes.
This is about me. This is in reference to myself. I happened to have been diagnosed 8 years ago with a hiatal hernia. I had the H. pylori. Prior to that, I didn't really have GI problems, and I was scoped several times, and I've been told that I've got chronic gastritis. I have the hiatal hernia. I take Prilosec at the current time, but it makes me miserable. I'm always having flatulence associated with cramps. I've taken mostly all those proton pump inhibitors. I've lost 30 pounds already. I mean, I'm not that overweight, but I don't know what to do. What can I do for this? And if I don't take the medication, have the burning up to my throat.
Okay, let's see what Dr. Katapani says in a minute or less. Yes.
Okay.
Yeah, there are a lot of issues. Now, the H. pylori, did you get treated for that already?
I was treated, and I did very well with it. I was tested afterwards. I'm negative for that.
So it was eradicated.
Right.
And you've tried all, I mean, have you tried the higher dose of the proton pump inhibitors?
I'm on the 20 milligrams once. I initially started with 40 milligrams of Prilosec, and I started getting severe palpitations. So I hate to say this, but I am a nurse. I'm a retired nurse. So I looked it up in my PDR and it said it can cause palpitations. So I notified my doctor. He put me on an Holter monitor, and then I said I'm not going to take it. I'm not going to take 40 milligrams. I'll only take 20 milligrams twice a day. So now I only take 20 milligrams once a day. I don't have the heartburn, but I have terrible flatulence. But that's one of the side effects of the medication. I don't know what to do with that. I mean, what I'm doing is exchanging one symptom for another. That's what I'm doing basically.
Yeah, and the second opinion here. I think we got to get because there are certain medications that cause certain problems.
And also lifestyle modification. There are a lot of, triggers. So I don't know if you're, following your diet.
We wish you good luck on both counts, okay? Because we're going to move on. We hope to hear from you next week. We got Larry who's been waiting patiently. Hello, Larry.
Yes, Dr. Garner, how are you?
From Rockland County?
Yes.
It's amazing.
Yes,
one of the most loyal viewers that we have, Larry, Maddie, and Joel.
Well, I enjoy your program. Just a footnote to your earlier caller. That was the Eliot Bible, and it was written in 1663.
You're right, absolutely. But you're looking for a plaque because you're not getting one.
No. I'm looking for an answer from Dr. Morano, if I can ask him a question.
Dr. Morano, sure.
Yes. Doctor, I've had gout attacks every so often, and a podiatrist told me that one of my middle toes is arthritic. But now I'm concerned. My fingers, my index finger and my middle finger, has lost the dexterity in both my hands. One a little more than the other. And I was told that it's a median nerve. Is that affected by rheumatics or arthritis in any way?
What's his name, Larry?
Yes.
Larry, you're all over the place. You went from gout to carpal tunnel syndrome to nerve entrapment to osteoarthritis. So let's clarify a couple of things. First of all, gout can be monoarticular, that means one joint, polyarticular, multiple joints, or oligoarticular, several joints. Okay. It can cause destruction of the joint, for sure. It could also be a cause of secondary osteoarthritis, because once you do damage to a joint, it tends to become arthritic. Osteoarthritis is a wear and tear of a joint. Now, if you have numbness and tingling in 1, 2, 3, and half of 4, that could be carpal tunnel syndrome, and that's usually from the median nerve. It could also be from the nerve in the neck, because if you have generalized osteoarthritis, you can have something in your neck. So what you really need is a rheumatological examination and an evaluation to clarify the situation. Have a good night, Larry.
Okay.
Hope that helps.
I appreciate that. Thank you very much, Doctor.
Have a great week. Call us next week.
Okay, Dr. Garner. Thank you very much.
Bye. We have Catherine with us. Hi, Catherine.
Yes.
Where are you calling from, Catherine?
Murray Hill?
Murray Hill. In Manhattan.
Yes.
Very nice. Nice place. Not too far from the East River Drive in the 30s?
Exactly, yes.
Very nice. Just quickly, what's your favorite place in that neighborhood when you want to get a bite to eat?
Rossini's.
Which one?
Rossini's.
Rossini's.
Yes.
Oh, Rossini's, Italian, yes?
Yes, yes.
Very nice place. I know it well. It's good place. What can we do for you?
I'd like to ask Dr. Borden the role that heredity places in depression.
Okay.
It's a good question.
Thank you.
certainly biology is important. We see that it can run in families, but no one should ever think because somebody in the family is depressed that I'm definitely going to be depressed. That's not the way it works at all. Really, it's, nature, nurture. And I think at the beginning of the show, when we talked about how you can live to be 100, or 120, 120, we heard that you can do things to help yourself and that genetics just plays a very small role, 20 to 30%. And I think that's what we have to think of when we talk about these types of illnesses as well. The most important thing to remember is that no one need feel hopeless or helpless. No one need feel sad for more than 2 weeks because there's help out there.
Thank you. Thanks for the call. Have
Thank
a
you
have a
very
nice
much.
week. Be well. Hi, Harry. How are you?
Hi, how are you, Doctor?
Good. Where are you calling us from?
Midwood, Brooklyn.
No, not bad. Where, around Avenue M?
Avenue J.
You know what I found out? There used to be a place on Avenue M. Do you remember that diner on Avenue M?
Diner.
What was the name of that place? If anybody remember, which one?
Can't think of it offhand.
Right, but that place now is in Mill Bay. It's in out in Far Rockaway, and it's
okay.
yeah. The same people opened up a place out there, a steak place. What's the one with the M out in Far Rockaway?
Don't know it.
Bell Harbor Steakhouse, it's called. They opened
no,
it up.
I'm not familiar with that, but I am familiar with Brighton Beach with Mrs. Stahl's Knishes because I used to live there.
Oh,
They were delicious too.
Unusual knishes, right?
Oh, delicious! Yeah, they have all kinds. Yeah.
What can we do for you?
Okay, I have diabetes. I was diagnosed with type 2, and I'm on some pills and I'm on insulin. I don't always have to take it every day. Sometimes my blood sugar level can go down to 110 or 112. Sometimes it can go up a lot higher depending on what I eat. Now, my doctor told me there's no way I could get rid of the type 2 diabetes, but I was told by a couple other doctors, plus some magazines and articles I've written about diabetes, that it's very possible that if I lost the weight I gained, because I'm 5'6" and 300 pounds, so that's when I noticed I had the diabetes.
One too many knishes there, Harry.
Excuse me?
Too many knishes.
Yeah, and some good pizza too. But the problem is that I have bad knees, so it's hard for me to exercise like I used to. That's another thing I need to do is knee replacements, I was told, because I have arthritis in the knees from injuries. But getting back to the diabetes question, what I wanted to know is it possible if I lose this weight and get on an exercise regime and I eat properly, can I get rid of this type 2 diabetes?
This is the question, Dr. Caterpillar. Can you get rid of type 2 diabetes?
Well, it depends. I mean, if you have mild diabetes and, like you said, you're overweight, you definitely can, if you lose the weight, you can get rid of not get rid of the diabetes, but you can control it with diet, okay? Because type 2 diabetes, one of the big components in somebody like you who is overweight is insulin resistance, meaning your body might be producing a small amount of insulin, but because you're obese, you have a very high level of insulin resistance, meaning the insulin is not as effective as it should be. So if you lose the weight, you lose that insulin resistance component, and you might be able to control your diabetes just with diet. But it depends on how bad your diabetes is. You should know what your glycohemoglobin is, and just follow up. And I think it's time for us to go. Yeah.
I'm going to make a suggestion. People overweight and osteoarthritis of the knees, more common in women than men. But what you should be going to is water. Exercise and water, the buoyancy of water. If you exercise your muscles, your sugar requirements will go down. And if you lose that weight, you might not require medications at all. So if it's a goal to try to keep, good luck to you.
Yeah, Harry, be well. Go easy on the DeFara's pizza.
Can I just add something?
I think we got to move.
It's $5.
We got to move on to Kathy. Kathy, you're the last caller of the night. How are you? Kathy?
Hi, how are you?
Hi, where are you calling us
I'm
from?
here.
Where are you calling us from?
From East Flatbush.
East Flatbush. What can we do for you tonight?
Okay, I have lupus, and I wanted to know how important is it that I get the flu vaccination and the swine flu vaccination?
Okay, Dr. Morano probably sees a lot of lupus patients. What do you think?
Their immune system is, some people think I have to heighten my immune system. Their immune system is heightened already. There's an autoimmune condition where you attack yourself. And basically, you're like everyone else, should avoid getting the flu. You should be vaccinated with the flu vaccine. Depending on medications that you're on, there's some live flu, especially with the aerosol one, that's live flu. I don't know if that's the best thing for you to take. But the flu shot is a smart idea, because if you get an infection and you're already on medications that suppress your immune system, then you could get pneumonias very easily, and it could lead to other problems. Good luck to you.
Thank you very
Get that flu shot, okay?
I will. Thank you.
Boy, I can't believe it. It's flown by. Let's not forget Brooklyn College on the 21st of this month of October, 12:45. Look on the website for details. A live Ask the Doctor. A lot of clamoring for live seats at this performance. Come in and we're going to answer your questions. So I can't believe this flown by. That's it for this edition. I want to thank Dr. Carapati, Dr. Morano, and Dr. Borden for coming in, and we hope we were able to help you. It's good to remember you should be proactive about your own health. Speak to your doctors about your concerns, and remember, go for second or even third opinions. In the meantime, continue to watch every Tuesday night at 8 p.m. or visit the website at net.ny/askthedoctor, or there you can catch my video blogs, see past episodes, or send in questions. We also have the new forum where we can discuss topics we didn't get a chance to cover on the show. Now, another announcement I'd like to make again, so you don't forget this, I want to be at Brooklyn College on October 21st to have a live Ask the Doctor show. More details to come. So please go to the website and you're going to find all the information you need. And thanks again for all your calls. And I want to see you next week with a brand new episode where we're going to cover kidney disease, heart disease, and internal medicine. Goodbye, stay healthy, and I'll see you in the tablet.